Scoliosis is an abnormal curvature of the spine, and once it affects the spine, you affect something called cerebrospinal fluid. And cerebrospinal fluid is actually the fluid that nourishes your spine and brain. And this flows typically by normal motion of the spine, typically the pelvic girdle into the lumbar spine, thoracic spine, and up into the neck, and helps pump the cerebrospinal fluid up and around and helps nourish the brain. What ends up happening with patients with scoliosis is because of the spinal rigidity and abnormal pelvic alignment, the cerebrospinal fluid can't flow properly. And if it can't flow properly, it can affect the way it nourishes the brain, which can lead to abnormal concentration and memory issues because it's not getting the proper nutrients. Also, a lot of times the scoliosis can affect the neck, and then when you have the neck, you can affect hemodynamics to the brain, meaning blood flow to the brain, which also can affect concentration. And lastly, scoliosis can have a negative effect on memory and concentration by just simply causing pain. We know pain affects these things, so therefore any type of pain index there could